This presentation is on stress and disease. Physiological stress refers to our perceived or an anticipated threat that disrupts our well-being or homeostasis. And this stress can arise from various sources, being psychological or emotional stress, physiologic stimuli, physical stimuli, and any other type of physiological change, such as think about infection and inflammation. Any of those things can trigger some sort of stress response. The concept of stress and its physiologic effect was first described by Walter Buchanan, and he is the person that termed the phrase fight or flight response. And this involves activation of the SNS or sympathetic nervous system and the release of our stress hormones such as adrenaline, cortisol, preparing our body to confront or to escape from that perceived threat. And we will be talking more about Cannon's thought on this. And also, in terms of learning a little bit more about physiological stress, Hans Selye, he further expanded on this understanding and its psychological effects. And his work demonstrated that if you are exposed to chronic or prolonged stress, it can lead to physiological changes, which include changes in our adrenal gland, could become enlarged. We can have decreased levels of lymphocytes, remembering that that is a type of immune cell that we need. And also, it could even develop into an ulcer. He concluded that this physiological stress impairs our body's ability to resist future stress, and this will lead to an increased state of vulnerability and even decreased resilience in the future. So these early findings that laid this foundation of our understanding are really important to help us to understand what the immunological consequences of stress are going to be. Chronic and excessive stress over time does have detrimental effects on our various body systems. It could be our immune system, even our cardiovascular system, our GI tract. These are just a few examples. It's going to lead to the dysregulation of our immune function. We're going to have increased inflammation throughout our body and also an increased risk of just developing stress-related disorders and diseases. We're going to talk about the GAS, which is the General Adaptation Syndrome. And this was termed by Dr. Selye, and he thinks that primarily physiologic stress has 3 stages. And that first part is the alarm stage. This is our body's initial response to the stressor or the stimuli, whatever is triggering the activation of stress in our body. And once that stress is perceived, it then activates the HPA axis, the Hypothalamic-Pituitary-Adrenal axis. A release of hormones will occur from the hypothalamus and the pituitary gland and the adrenal glands. This HPA axis activation is going to lead to a release of stress hormones from these glands, particularly cortisol from the adrenal glands. And then the sympathetic nervous system becomes activated and it releases adrenaline and noradrenaline. Hormonal and neural responses will prepare the body for immediate action. And this is that arousal of the body's defenses. The psychological changes during the alarm stage include certain manifestations such as an increase in heart rate, elevated blood pressure. We might even have a heightened mental alertness, and this is going to increase even our ability to have more energy and to become stronger. Once the body enters this mobilization stage or this fight or flight response, this is going to help the individual to respond to that stressor. And so the goal during the alarm stage is really to activate then all the necessary defenses so that the person being plagued by the stressor can put up the necessary defenses. Then we have the resistance adaptation stage. And this is occurring right after the alarm stage. Your body is going to become resistant or either adapt to cope with the ongoing stressor. This stage is characterized by the adrenal hormones, particularly cortisol. And this is going to help maintain and sustain our response to stress. But this is also going to contribute to the mobilization of our energy reserves. So then our body has all the necessary resources it needs to prolong itself through this stress. The adrenal hormones are going to contribute by mobilizing this energy reserve. Remember, again, it's going to make us stronger, and it's going to help us to make sure we have what we need during this time. The adaptation during this stage really aims to support the body's fight or flight response and help us to adapt to the ongoing stressor. Then we move into the allostatic overload phase or the exhaustion phase. And this is when the stressor continues to persist for long periods of time and our body's adaptive resources become depleted. So during this stage, your body's ability to cope and adapt become compromised because of the prolonged exposure to the stress. We have the inability to effectively adapt over long periods of time to this stress, and so that leads to allostatic overload. Allostatic overload is the cumulative wear and tear on our body system due to stress. This exhaustion stage is associated with a development of stress-related disorders such as chronic fatigue, anxiety, depression, and other various physical illnesses. So it's important really that we learn how to manage and alleviate stress during these stages so that we can prevent the long-term negative effects that occur or can occur. We have a reactive response, which is a physiological and psychological reaction that occurs in response to that stress stimuli. Direct response is to the immediate presence of whatever's stressing us out, whatever is triggering that body's alarm stage. But then the reactive response is what activates the body's stress during this response system, such as the HPA axis and the SNS. Psychological changes and physiological changes happen. Physiologically, during this reactive response, again, things happen to our cardiovascular system. Our heart rate increases, our blood pressure increases, heightened alertness, and enhanced physical readiness, that fight or flight. So you want to remember that this is occurring as part of this phase. Anticipatory response, this is that preemptive reaction that occurs when we anticipate the potential stress or we anticipate a future stressful event. It's the psychological and physiological response that's triggered by the expectation or the perception of a stressor. So, what influences this anticipatory response? It could be past experiences, past beliefs about certain stressful stimuli, cognitive processes. These all shape the body's preparation for how we perceive stress and how we perceive the stressor. Our physiological change during this anticipatory response, this can include muscle tension, heightened arousal, changes in our breathing patterns, and activation of the stress response systems. So we need to understand that the anticipatory response is helping the individual to become prepared mentally and physically. In terms of psychoneuroimmunology, we have to first understand what that means. This is the interdisciplinary field that explores and studies interactions between the psychological processes that happen, the nervous system, and the immune system together. So we know psycho means consciousness or cognition, emotions, and other psychological factors. While this will influence our immune response, our mental and emotional state, they really do have such a profound impact on our immune system and overall health in general. Psychological factors like stress, our mood, our beliefs, our social support, these all influence our immune function and our susceptibility to disease. There are validated studies that show there's a positive correlation between positive emotions, relaxation techniques, and positive social interactions that really do enhance immune function. And so when there's chronic stress and negative emotions, it will weaken the immune system. So positive thought really does improve your health against stress. Immune modulation by psychosocial stressors. This is the next concept that we want to think about. The psychosocial stressors, let's say a life event, an unplanned event may cause chronic stress. Maybe there's a chronic disease, social isolation. Maybe there's a patient that is going through negative emotions. These can all modulate that immune system. And the immune response that our body is able to produce is affected by this stress-induced change in our neuroendocrine and our immune pathways. This chronic stress can lead to dysregulation of the immune system altogether. And so then it puts the patient in more or an increased susceptibility to infection. We may see delayed wound healing and an increased risk of autoimmune or inflammatory diseases. The stress hormones, such as cortisol, this can suppress our immune function and impair our body's ability to fight effectively. Inflammatory processes in the body, which are triggered by stress, this can also contribute to the development of various diseases. Allostasis, or the stability through change, is a process when the body achieves a level of stability even though there are physiological and behavioral changes occurring. We can stabilize our physiological and behavioral response. And the brain plays a crucial role in this because it's continuously monitoring the environment. It's helping to predict future events and anticipating things that we might need from our neuroendocrine and autonomic systems. This anticipatory response allows the body to proactively adapt to stressors and to maintain homeostasis. Allostasis, this helps to ensure that the body's physiological systems are prepared to work and to respond to the challenges, and also to just maintain overall stability. So what does allostatic overload mean? Well, if we are in a constant state of stress and there's an overactivation of the adaptive systems that our body is able to contribute, and this will sometimes lead to our stability being compromised. Think about something that is occurring chronically or repetitively. This stress can lead to this allostatic overload, because although we hope through allostasis to have stability through change, the repetitiveness and the chronicness of these stressors can cause this overload. Allostatic overload is highly individualized, which means that in different individuals, they may experience different thresholds for too much stress, and different thresholds for the various responses. Prolonged or excessive activation of a stress response can have negative consequences not only on our physical well-being, but again also our mental well-being. So it's important that we assess to see what are these associated symptoms. Well, increased risk of stress-related disorder, cardiovascular disease, metabolic disease, mental health, immune dysregulation, all the things we've already talked about. If our body is not able to maintain allostasis and becomes overloaded, then we are putting ourselves at risk for disease. The hypothalamus is a region in our brain that plays this key role in the stress response, because this is going to secrete the corticotropin release hormone, or CRH. And this hormone then is going to push forward the stimulation of the pituitary gland located at the base of our brain. And our pituitary gland is going to release ACTH, adrenocorticotropic hormone. Now, when this happens, this hormone is going to travel through the bloodstream and eventually it's going to reach the adrenal glands. And once it reaches the adrenal glands, which are located over the kidneys or on top of the kidneys, this is going to cause the adrenal glands to secrete cortisol. Cortisol being that stress hormone. We're also going to have catecholamines, including adrenaline and noradrenaline. So with cortisols and catecholamines together having various effects in our body, this can include blood glucose level increases, our immune system becomes suppressed, and it's promoting the release of our stored energy. So remember that activation of the HPA axis and the release of cortisol and catecholamines, they're just part of the body's physiological response to stress. So these hormones can help prepare our body for that flight or fight because it's giving us energy. And again, it's enhancing our alertness and our strength. So there are some positives for having the HPA axis. However, chronic or excessive activation of stress can lead to a negative effect on our overall health. You can see with the neuroendocrine regulation via the HPA axis or the hypothalamic-Pituitary-Adrenal axis, it's pretty complex and it involves the regulation of various physiological processes, including what we're talking about, that stress response. It plays a crucial role in coordinating the body's response to these stressors, psychological and physical. With the hypothalamus, that stress response, this is where it is initiated. Moving to the CRH, that CRH tells the pituitary gland to release that ACTH. That ACTH is going to travel through to the adrenal glands, which is going to release cortisol. And then the adrenal medulla, which is responsible for the release of the catecholamines, including adrenaline, or sometimes we call it epinephrine, and noradrenaline, also called norepinephrine. These hormones are going to act rapidly, and these are the hormones that are increasing our heart rate, blood pressure, our energy, and our physical, our increase in physical action. Now, looking at the negative feedback though, once the stressor is resolved, the cortisol levels are going to decrease. The HPA axis is going to return back to that baseline because we have that negative feedback loop. The cortisol levels that exerted those inhibitory effects on the hypothalamus and pituitary gland are going to be reduced as well because the CRH and ACTH are going to be reduced respectively. So it does respond by increasing through this cascade, if you want to call it, of hormones, but also it will decrease as that stressor is removed. So cortisol, we keep calling this the stress hormone. This is a glucocorticoid hormone secreted by the adrenal glands in response to stress. It's widespread, and its widespread effects through the body point to different responses that our body has with cortisol. So when it's released during stress, it's released in large amounts. And whether that stress is physical or psychological, we're going to have that activation of the HPA axis, and then it's going to lead to the production and release of cortisol into the bloodstream. It can be distributed to all the tissues. So once it's released, it's circulating through that bloodstream, it's going to reach the tissues in the body, goes across the cell membranes, and it's going to start to bind to specific receptors in the target tissues. It's going to stimulate gluconeogenesis. And this is when the production of glucose from a non-carb source, such as an amino acid or fatty acid, is affected by cortisol. So our blood glucose is going to increase, providing our body with more available energy during stressful situations. Also, in terms of protein metabolism, cortisol is going to promote the protein breakdown. So we have protein catabolism in various tissues. And so this serves as a source of amino acids for gluconeogenesis. So we're breaking it down to help with gluconeogenesis. But it also inhibits protein synthesis. So then it leads to muscle wasting if we're under chronic stress over long periods of time. Cortisol also has anti-inflammatory and immunosuppressive effects. It is a potent anti-inflammatory. It helps to regulate and suppress that immune system. It prevents an excessive immune response. And this is beneficial sometimes because it can be beneficial in controlling our inflammation if there's an acute situation where we need a negative thing to happen. But it can also have a negative consequence when it's prolonged or dysregulated. The stress response itself, cortisol, is involved in regulating our body's response to stress. So it does influence our mood, our behavior, our cognition, and our overall ability just to cope with stress. Chronic excessive cortisol levels do have a detrimental effect. So if that feedback loop or that negative feedback loop doesn't become or doesn't get pushed into play, we can have effects on our mental and physical health. Abnormal elevations in cortisol levels have been associated to these various health diseases. So again, the metabolic effects we're going to start with first. Cortisol has been linked to obesity because it promotes that accumulation of fat. And particularly, we're going to have abdominal visceral obesity. It's also associated with lipid metabolism disturbances, which then leads to an increased level of circulating lipids throughout the body. And this can contribute to hypertension, insulin resistance, and eventually it's going to lead to diabetes. In terms of our cardiovascular disease, we've kind of talked about most of this already, but it can also lead to atherosclerosis. And this is when we have elevated cortisol levels that will then form and progress into plaques in our blood vessels. And when we have plaques, it decreases the ability for blood to move through. It decreases the space for our blood to move through our cardiovascular system. This is going to increase the risk for heart attacks and stroke. In terms of bone density, we can easily have changes due to prolonged exposure of cortisol as well, because cortisol promotes bone resorption or bone breakdown, but it also inhibits the formation of bone as well. And so we lose that density. If we have increased levels of cortisol over time, it does put your patient at risk for osteoporosis as well. In terms of inflammatory modulation, it's important to note that the secretion of cortisol during stress, it inhibits the immediate inflammatory response. But over time, this excessive level can lead to just an overall dysregulation of that immune system, and it contributes to chronic inflammation. Cortisol also plays a role in the resolution of inflammation and tissue repair. It dampens that inflammatory response once that initial threat has been removed, and then it will promote the synthesis of anti-inflammatory molecules and modulates that immune system so that we can promote tissue healing and thus repair. With T-cell apoptosis, we know that cortisol induces programmed cell death in certain immune cells, such as the T cells, and they can have implications for immune function and regulation. Excessive cortisol levels or dysregulation of cortisol secretion may impact the immune system's ability to mount an appropriate response to further infection or other immune challenges. So we have to really understand what these abnormal levels of cortisol can do, how they are positive, but then also how they are negative for our health. Therapeutically, the synthetic form of cortisol, such as prednisone or dexamethasone, they're used in medical practices because they have an anti-inflammatory or they can become an immunosuppressive agent. They're prescribed to suppress the immune response and control inflammation in various conditions. So for those people that have autoimmune diseases, we tend to use synthetic cortisol, allergic reactions, and even during organ transplant to help prevent tissue or organ rejection. On the immune cells, again, the lymphocytes, monocytes, macrophages, dendritic cells, natural killer cells, it modulates their function and their interaction, so it can lead to the suppression of immunity or immune response. In innate immunity, if we have high levels of cortisol, whether it's due to chronic stress or maybe we're using it in therapeutic use, it may have a suppressive effect on innate immunity, and so it dampens that innate immunity response, such as the activation of the phagocytic cells like macrophages and the production of our pro-inflammatory cytokines. These all can be decreased. So we're losing some of that immediate response to a pathogen. For autoimmune responses, it's important to note that if we have prolonged or excessive elevation of cortisol, this can activate an autoimmune response, or it can put us at risk for an autoimmune response. And so what that means is that high levels of cortisol can really disrupt the balance between our body's immune tolerance and the immune activation or immunity. So we have this dysregulated cortisol contributing to an exacerbation of autoimmune diseases, and where the immune system would normally save us from that, it's mistakenly attacking our body's own tissue. With catecholamines, their role in the stress response and immune modulation starts with epinephrine or adrenaline being released from the adrenal medulla during the stress response. And this plays a big role in coordinating our behavioral and our physiological responses to stress, because it acts upon the SNS. It signals that SNS, and this is what puts us into that fight or flight. Catecholamines exert their effect by binding to specific receptors called adrenergic receptors, and there's two main types. We have the alpha adrenergic and the beta adrenergic receptors, and within that we have 1 and 2. The activation of the alpha 1 receptor leads to vasoconstriction and increased blood pressure. On alpha 2, this is playing a role in the release of neurotransmitters and hormones. Now on the beta adrenergic receptor, beta 1 and beta 2. Beta 1, once it becomes activated, this is primarily affecting our heart rate, the contractility of our heart, and the beta 2, these are found on various smooth muscles, including our airway and our blood vessels. So if we're activating beta 2 receptors, this causes bronchodilation and vasodilation. So understanding our alpha and beta adrenergic receptors will also help you in pharmacology to understand the types of medications that are targeted to these receptors. Catecholamines can modulate immune responses through their effects on the immune systems by mimicking a direct sympathetic stimulation of that immune cell. And this can be this can lead to increased pro-inflammatory cytokine production. Our catecholamines enhance the production of pro-inflammatory cytokines. And remember, the pro-inflammatory cytokines were interleukin 6, for instance, tumor necrosis factor alpha. This can contribute to inflammation and immune activation. The peripheral corticotropin releasing hormone, CRH, and neuropeptide Y, or NPY, these are important molecules in immune modulation as well. For CRH, it's not only produced in the hypothalamus, but it's synthesized and released to the peripheral tissues as well, including the immune cells. And so peripheral CRH has a pro-inflammatory effect on target mast cells and the type of immune cells that are involved in allergic reactions. Histamine release, when peripheral CRH binds to that mast cell or to mast cells, it triggers the release of histamine, which is a potential mediator of inflammation. And histamine contributes to active inflammation and allergic reactions. The T helper cells, once the CRH has been put out into our system, it can suppress the activity of that T helper cell. And so we need those T helper cells. They help with the cell-mediated adaptive immune response. And at the same time, it can promote the activity of T helper 2 cells. These are involved in the allergic and humoral immune responses. This balance of the T helper 1 and 2 activity, it can impact the immune regulation and contribute to an allergic reaction. With NPY being a neuropeptide, it acts on the sympathetic neurotransmitter, and it's involved in various physiological things or processes. It includes our stress response, immune regulation. The sympathetic neurotransmitter, NPY, once it gets released onto the sympathetic nerves, it acts as a neurotransmitter that helps with the sympathetic activity or that fight or flight. The NPY is also a growth factor, and it has effect on certain cell types, such as being able to influence proliferation of a cell, the survival, and also the differentiation of cells. The CRH and the NPY, they contribute together to the immune modulation effects on our immune cells. So let's ask this question. A patient experiences a stressor that activates a stress response. What are the physiological effects seen when catecholamines are released into the bloodstream? The physiological effects of catecholamines on organs and tissues are increased heart rate, force of contraction, bronchodilation, and decreased insulin release. This can also increase our blood pressure due to peripheral vasoconstriction. The answer here is A. Now we're going to look at the relationship between stress and the immune system, noting that it is complex. We've seen it already, but it's bidirectional. Stress can be directly influencing our immune system, but the immune system can also influence our body's ability to cope with stress. Stress has been shown to stimulate the release of those pro-inflammatory cytokines, and we talked about that. That was interleukin 6 and tumor necrosis factor A. Why do we need those cytokines? Well, they initiate and sustain inflammation. So if we have chronic activation of the stress response, then we can lead to a chronic low-grade inflammation through our body all the time. So think cardiovascular disease, metabolic disease, and even cancer. Prolonged or chronic stress can dysregulate our immune system function, and this induced immune alteration now affects our ability to be effective the next time we need to mount an immune response. We looked at the stress response by the activation of the HPA axis and the sympathetic nervous system, knowing that the cortisol and catecholamines will be activated, and then therefore they can decrease the cytotoxic effect of T cells. They can also impair the function of B cells as well in the antibody production process. Prolonged or chronic stress results in immunosuppression. Individuals become more susceptible to infection. When we're trying to heal, it could impair our healing. It impairs our immune surveillance against cancer cells. And these stress-related factors can suppress the activity of natural killer cells, cytotoxic T lymphocytes, and these are all critical for us to be able to target and eliminate abnormal cells. Now, stress is a system that's interdependent, right? It's moderated by nature, the intensity, duration of the stressor itself, and then our perception of that, or our patient's perception of that, and our ability to cope. It's all going to affect our body's ability to withstand the stress, but also just overall how it affects this individual. There have been numerous studies that have shown that when we are at high levels of stress, we have these alterations in immune systems, and then we know it reduces those cytotoxic T cells that we need to mount off the foreign pathogen, and also we saw in B cells in the humoral immunity pathway. How individuals cope with stress can influence that immune function. If we have effective coping strategies, think about social support, or we're able to do really well with problem solving or reframing our situation in a positive way, this has been associated with better immune outcomes. So there's a lot of research on this. But on the other hand, if we have maladaptive coping strategies, think about avoidance, it may contribute to prolonged stress, negative impacts on our immune system. High levels of anxiety or depression can also further exacerbate the negative effects of stress on our immune system. So we have to think about the patient holistically and not just physiologically. Psychosocial distress, this refers to the experience of the psychological and social challenges that a patient may undergo. It has significant impact on their health, and it can be manifested through physiologic, emotional, cognitive, and even behavioral changes. Again, it influences our immune system, and it increases our risk of immunological defects. The deficits that occur, if we have severe and chronic psychosocial distress, this can be associated with immunological defects such as the T cells and the B cells, right? And those are the key components of the immune system. We talked about that in depth. Chronic disorders, if we don't address this stress, and now the psychosocial distress is heightened, this has also been linked to chronic disorders and increased the severity of these chronic disorders, because what we're getting is increased states of inflammation and a dysregulation of that immune response. If we can identify and reduce the psychosocial distress in a clinical setting, then we can help, as nurses and as nurse practitioners, to play a role in disease prevention and illness management. Easier said than done. Implementing stress reduction techniques and interventions can help mitigate the adverse effects. However, sometimes we don't understand the strategies that we can use. Sometimes the strategies that are recommended are things that patients don't want to use, such as relaxation exercises, mindfulness, social support, reaching out to people that love and care about you. Some people like to hold on to their stress and not allow the shared reality of what's going on. All of these things can help improve the immune response. Even cognitive behavioral therapies, going to talk to someone, praying, addressing your spirituality. If we can address this, then promoting stress reduction can occur. And so we do have our job not only to talk about and to intervene physiologically, but we have to address the psychosocial aspects of our patient. What does coping refer to? Coping is the cognitive and behavioral efforts that we make to manage our stress. It can also be how we manage challenges and adverse situations in our life. Coping can be either adaptive or maladaptive, and this is just going to depend on the effectiveness in dealing with our stress. So adaptive coping, some examples are, again, problem solving, inviting others to be part of the conversation. Overall, adaptive coping is being able to manage your stress and improve your overall well-being. But it does make you a little bit vulnerable because you have to seek social support, ask for help, ask for emotional support, advice, assistance. Social support can provide a sense of comfort if we can get over that hump of being embarrassed or not wanting to talk about what's going on. It can also provide validation and buffer that impact of stress on our health. Whereas maladaptive coping, these strategies are ineffective and harmful. Things like ignoring, avoiding, denial, self-isolation. Some patients will turn to substance abuse and other unhealthy behaviors. These things are going to increase the stress, worsen your mental health, and also have more negative physical effects on your body. So let's ask a question. An example of adaptive coping response to stress is what? Again, if we seek social support and encourage our patients to seek social support, we are more prone to a positive adaptation to coping, which then will hopefully reduce the stressful experience overall. The answer here is C. Stress age syndrome. This is the physiological change. This occurs in response to being influenced or prone to chronic stress over time, but also how it affects the aging. It involves the alteration of the neuroendocrine and the neurotransmitter systems. What does this mean? In terms of the limbic system and the hypothalamus, this chronic stress can lead to excitability. And this then will affect the hypothalamus and the limbic system, which are involved with regulating our emotions, our behavior, and our stress response. Neuroendocrine changes, these chronic stress and then aging on top of it, this can disrupt the normal functioning of our neuroendocrine function. This is the system that puts out our catecholamines, right? Our epinephrine, our norepinephrine. Also, our antidiuretic hormone, ADH, ACTH, adrenocorticotropic hormone, and also cortisol. Other hormonal changes that we can see, it could lead to a decrease in testosterone, thyroxine, and other hormones that we need to maintain our overall health and vitality. But the hormonal changes can contribute to various age-related symptoms and conditions if we don't address it. And then lastly, the opioid peptides, which are naturally occurring in our body. They help with pain modulation, mood, and stress responses. Chronic stress and aging can impact the production and the activity of our opioid peptides. So then our pain perception is being affected. Our emotional well-being and our stress resilience is also being affected because of the negative effect on the opioid peptides. With immunosuppression, we have prolonged exposure to stress, again, that weaken immunity. So it affects our T cells, our B cells, natural killer cells, that chronic inflammation that happens. It puts us in a state of dysregulation of T and B cells, and also the production of our pro-inflammatory cells. Remember, cytokines, chemokines. This is all going to cause persistent inflammation. This persistent inflammation then increases our risk for age-related diseases, cardiovascular, metabolic, neurodegenerative diseases. It can also change our lipoproteins because it can increase the levels and the composition of the lipoproteins, and this increases LDLs and decreases our HDLs, which is our good cholesterol. Chronic stress also changes platelet aggregation and activation. It increases this. And so with this, if this increases, the coagulation cascade is going to result in an increased risk of blood clot formation. And so our patients are at an increased risk of heart attacks and strokes and other cardiovascular disease. And then lastly, with free radical damage, are knowing that that means excessive free radicals and reactive oxygen species, or the ROS, in the body. It can cause damage to our cells overall. It can damage our DNA, proteins, our lipids, and then this is going to contribute to damage in all cellular dysfunction and tissue damage. So oxidative stress and free radical damage, they are bad for us. They've been implicated in pathogenesis, including cancer, neurodegenerative diseases, and cardiovascular diseases. So, in conclusion, identifying stress and helping our patients work through this and cope with stress effectively is important to their overall physical well-being, psychosocial well-being, and don't forget to address their spiritual well-being as well.